So I want to talk about discs in the spine today and the different things that can happen with a disc to cause pain and radiating pain, things like sciatica. The discs in your spine are between every vertebra, and they're supposed to be nice and thick like this. As we age, we'll just talk about degenerative discs first. As we age, these discs get wear and tear, just like the sole on your shoe or something. They begin to narrow. As the discs begin to narrow, your body wants to stabilize the area, and then it'll form arthritis, these little bone spurs. And so as you age and you get arthritis, you can get what's called stenosis, which just means narrowing. And so the disc or the arthritis will narrow this area where the spinal cord is, or it'll narrow these holes where the nerves come out. And so you can have the arthritis, and you can have a disc bulging or protruding back, and that will pinch a nerve in your lower back. So if you're older, or if you've got degenerative discs and you stand, the standing puts more pressure on these degenerative discs, and then you'll end up feeling more pain while you're standing. A lot of times when you're young, you'll feel more pain when you sit. The reason for that is when you're younger, and when I say younger, I mean maybe 50, 60 and below, your discs are softer and thicker. And so when you bend at the waist, for instance, or when you sit, that would be going this way, it puts pressure on the front of the disc, forcing the disc backward like that, and then you'll end up pinching a nerve like this. So a lot of times if you have more pain when you're sitting, it can still be a disc, but your disc is probably healthier actually when you have pain from a sciatica or something when you're sitting. You might have a healthy disc. It's just been your posture has been a lot of bending and lifting and sitting has created a disc that's bulging back and hitting the nerve. So the disc has tough rings of cartilage, and it's got a soft part in the middle. This is what we would call a protruding disc, or you might call it a herniated disc. And that's where the tough rings of cartilage on the back side of the disc get weak, allow the soft part of the disc to push in, and then there are nerve roots on the sides like this, and you'll see that disc kind of hit that nerve. So if you have a disc protrusion or a disc herniation, that would look something like this. If you have a disc bulge, that's typically more where a larger portion of the back side of this disc is bulging out. You can have actually pain down both sides of your buttock or legs from a disc bulge or a protrusion, and you can have back pain from a disc protrusion or a disc bulge. When you cough or sneeze, if you have pain, especially when you're younger, and it shoots down your leg or causes sharp back pain, that can be a disc bulge or a disc protrusion. So the primary things we're dealing with are a disc protrusion, a disc bulge, and degenerative discs. There are times when you have what's called a disc extrusion. Those usually happen when the back part of the disc gets a weak part on these tough rings of cartilage. The soft part bursts out, and then you get this gooey nucleus part of the disc that bursts out onto the nerve root. Those can be hard to treat conservatively, but the body actually over time, much of the time, will absorb that disc when it's been extruded. And so we treat all types of disc issues. We have different techniques that we use. We have decompression tables that pull pressure off the disc and causes a suction effect to draw the disc back into place. We have ways that we teach you to do certain stretches and exercises that will help the disc to recover. And we do adjustments also that will help the disc to sit properly in the spine. And so if you're having any kind of sciatic nerve type pain, disc issues, these are things that we can handle. If it's an issue that we can't handle, I always will send you for an MRI, send you to a neurosurgeon, orthopedic surgeon, someone who can get you some help.